most important topic in the NCLEX RN exam. So without this topic, your exam is incomplete, because why? When you're working on the floor, you have to deal with insulins every single day. So we will be talking about what kind of questions they can ask you in the insulin. So insulin as a topic hai, this is a really big topic. I can fill up this board. Maybe you're just reading from multiple books or multiple question banks, but still you're confused what they can ask you. If you're reading in detail, that will not help you to pass your NCLEX RN exam. So if you're my student, you know that we like to read on the point whatever information you will use on the floor and the information they will test you on. So the first thing you need to know, types of insulin. We know there are the 4 types of insulin: insulin regular, short acting, intermediate and long acting. Anytime you see Lispro and Aspart, they are talking about rapid insulin. Rapid, speed, fast. It means it will start working immediately. Exam question could be, we know the onset of rapid is 15 minutes. So if the onset is 15 minutes, onset meaning when it will start working. So if the onset is 15 minutes, because whenever insulin start working, our patient is at risk of hypoglycemia. Mind, कोई भी medication हम देते हैं, we are worried about the opposite side effect. For example, if you are giving the blood pressure medication, we are worried about the hypotension, opposite side effect. So that's why every time we administer these medications, we are checking the blood sugar, we are checking the vitals. Same way for the insulin, every time we are giving insulin, we are checking the blood glucose level in the patient. If it's below 70, it means it's a hypoglycemia. So we have to hold the insulin, but we need to inform the doctor for that. So keep that in mind. So food tray bedside. Food tray bedside for rapid, because it start working immediately within 15-minute time period. Next is a short acting. Just to remember, what is the second name of short acting? Regular insulin we call it. Regular insulin. Regular insulin के बारे में आपको 2 चीजें पता होनी चाहिए. First, हम IV देते हैं. This is the only insulin we can give IV, and ये clear solution होता है. This is a clear solution. Third is the intermediate. We called it NPH. NPH जो होता है cloudy solution होता है. इन दोनों इंसुलिन में से मिला के एक क्वेश्चन आपको आएगा, कैन वी मिक्स दीज? यस, वी कैन मिक्स दीज, बट विच वन वी विल ड्रॉ फर्स्ट? सो रिमेंबर द वर्ड RN, because you all are going to be RN, so registered nurses, regular, then NPH, always R and then N. Last one, long acting insulin. So long acting, the name itself, the long acting, it's acting for long time period, 24 hours. You need to know in the long acting, glargine and detamir in name for the long acting insulin. But the question for the NCLEX exam could be even for the LVN and RPN exam, because we know not only the registered nurse, even though LPN licensed practical nurse and RPN registered practical nurse deal with insulins, so they will test you on that information. We don't mix it, and there is no peak. We don't mix this insulin with any other insulin, and there is no peak. Important point to remember, as I mentioned earlier, remember the word RN, number 1 question for the NCLEX, very, very important. It could be the question, because most of the time nurses can be confused which one we draw first. Are we drawing the NPH first? But remember the word RN, registered nurse, regular, NPH. Then know that if the hypoglycemic state, if the glucose is already low, we need to teach our patient, any patient with diabetes, this could be the select all that apply question in your exam, कि कोई भी patient diabetes में है, हम उसको hospital से discharge कर रहे हैं with insulin, and what educations we need to give to the patient? We need to, number 1 education we need to give our patient, monitor the sign and symptoms of hypoglycemia, which could be nausea, vomiting, sweating, and we need to tell our patient what to do immediately to prevent that. So know the peak. Peak में जब patient peak में होता है तब hypoglycemic का risk सबसे ज़्यादा होता है. That's why we are giving the food to our patient immediately in the rapid one, because it start working immediately. So bedside tray, very important question. Another question they can test you, how we store insulin. For storage, if the insulin is unopened insulin, हम उसको रेफ्रिजरेटर में रखते हैं, फ्रिज में रखते हैं. But If we open the insulin, it is good to use for 28 days. That's why every time we are opening the insulin, we have to write down the date. Thank you so much. I hope this video is helpful for you to join my 7 weeks program. You can give me a call on displayed number. Good luck for your test.